Good morning. Today we have a case of 3-month post-op for bilateral temporomandibular joint replacement surgery. She came to us around 6 months back with a complaint of her facial deformity. She had extremely backwardly placed lower jaw. We call it like a bird face deformity, along with restricted mouth opening, and she was very much concerned with her look as well as about the mouth opening also. So we did basic investigations like CT scan, her sleep study. There was little bit of OSA, not very severe OSA, obstructive sleep apnea, on the report. But yeah, of course, there is a severe deformity. Her condyles were deformed, and it was more or less kind of a fibrous ankylosis. Her mouth opening was around 2 centimeter. So after checking all the investigation, CT scan, everything, we decided to go for a bilateral TGR along with the orthognathic surgery, which was counterclockwise rotation of her jaw bones and to get her lower jaw forward and give her a normal profile. Surgery was done 3 months back by me and Dr. Nehal Patel, and she was hospitalized for around 7 days, and post that she was here for follow-up up to 1 month, and now we can see 3 months post-op. Her mouth opening is also normal. Her facial profile has also improved quite a bit. She is happy. All her functions are good. She can chew her food nicely. Her look has also improved very much.